On Friday, I said that staying at home this Easter weekend would be a major test of the nation's resolve. And I'm pleased to say that the nation is rising to this challenge. I know that for some people, this has been extra tough. If you're at home with children, if you can't visit relatives because they're shielding, if you're unable to go to church on this most important day for Christians, your steadfast commitment to following the social distancing rules is making a difference. Thank you for the part that you are playing in helping to protect lives at this critical time in our nation's history. But we cannot be complacent, not when there's so much at stake. So please keep going. Stay home, protect the NHS, and save lives. Today I want to provide an update on the work we're doing to slow the spread of the virus and to build capacity. The latest figures show that in Great Britain we have 2,295 spare critical care beds, up 150 from yesterday. So, throughout this crisis, with all the challenges that we've been dealing with, all the operational difficulties and all of the logistics, we have always been able to provide the very best of care to everybody who needs it through the NHS. At the start of this crisis, people said that the NHS would be overwhelmed. And we've seen that, and we've seen the risk of that elsewhere, but not here. And that is because of the action that a huge number of people have taken, the incredible work of so many. There is more spare capacity now for critical care than there was when coronavirus first hit our shores. And this is before the Nightingale hospitals come on stream. London's opened, and we're already in the process of building 6 more around England. This critical expansion is partly because we have a record number of ventilators, 9,775, and partly because we have record numbers of returners coming back and rejoining the NHS. Over 5,000 former staff are now back on the NHS front line, and over 36,000 have come forward to enlist. And this bolstered capacity has been backed by substantial financial support. As the Chancellor has said, whatever our NHS and vital public services need during this time, they will have. But of course, there's always more that must be done. So we're increasing the amount of PPE, and I'm glad to say that there are now record amounts in the system. And we need the right amounts of medicine too. And I can assure everyone that we're working very closely with the pharmaceutical supply chain and hospital pharmacies so that the right medicines are there to treat people. And I'm glad to see the reassurances that have been provided today that everybody can have the medicines they need in order to get the care that they need. And when we debate the operational challenges we face, I want to be transparent about every single one. Let us not forget that the core measure of NHS capacity, which is what matters to you when you or one of your loved ones needs it, is whether you can get the best care if you catch coronavirus. On that we are succeeding. And in fact, succeeding more with each passing day.